Hello, this is video number 3 for the digestive system. And in this video, we're going to talk about topic A, the oral cavity and associated structures that aid in digestion. So how I plan to go through the rest of the videos is to go through this list of topics, different segments of the alimentary canal, talk about their anatomy, talk a little bit about the histology that's relevant, and list the main functions that are involved. I will try to highlight vocab terms. If you see something bolded on a slide, that's a vocab term. So I'll try to define those as I go along as well. All right, so let's start by talking about the oral cavity, the mouth, and what are the structures involved. First, just a list with some terms. Lips, uvula, tongue, teeth, soft palate, hard palate, all are involved somehow, either in taking in food, ingestion, or in the process of mechanical digestion, chewing, and mixing with saliva. So those are some of the main processes that are happening in the mouth as far as digestion concerns. So mechanical digestion is by chewing. The technical term for that is mastication. Mastication, the main type of mechanical digestion happening in the mouth. There is a limited amount of chemical digestion that starts in the mouth, and that's through an enzyme, or actually two enzymes that are contained within the saliva. So I'll talk about that a little bit more. The tongue, the salivary glands, and the teeth are considered accessory organs or structures involved in digestion. The main role of the tongue being a muscular organ, is able to move food around as you're chewing it, and it's going to help with mixing the food with the saliva, and it starts becoming homogenized through those processes, chewing and mixing with saliva. So what results is the mixture is called a bolus, basically a glob of wet saliva infused food that's chewed up. And this bolus is going to start making its pathway through the alimentary canal. And the first part of that is going to be swallowing. The tongue is involved in that as well. It helps to position the bolus at the back of the mouth. And then you swallow. Technical term for that is deglutition. This slide is showing some of the main structures involved. So some of these are going to be very familiar. Lips, of course. The hard palate and the soft palate, that's the roof of the oral cavity. Hard palate has a bony interior to it. Soft palate does not, soft tissue only. Soft palate comes to a point called the uvula, so that's at the back of the throat, of the oral cavity, and transitioning into the throat. So throat here and uvula there. There are tonsils associated with the oral cavity and also the pharynx. So I'll point those out. One of them are called the palatine tonsils, basically the lateral surfaces of the back of the oral cavity. The tongue shown here, muscular organ, it's attached to the floor of the oral cavity. And then beneath the tongue are various pores or opening orifices where saliva is secreted into the oral cavity. And of course the teeth. So we'll talk about the main types of teeth that are involved and their role in mastication, mechanical digestion of the food. Here's a mid-sagittal section through the oral cavity showing the same structures. So oral cavity here encompasses the tongue. Tongue is attached in the floor of the oral cavity. And here is the roof of the oral cavity. Hard palate has the bony interior to it. Soft palate does not. Uvula dips down into the transition between the oral cavity and the oropharynx. And the uvula pivots up when you swallow, closing the pathway into the nasal cavity. Okay, couple other tonsils. We talked about the palatine tonsils in the lateral wall of the back of the oral cavity. Lingual tonsils are at the base of the tongue. And so those are the main structures in the oral cavity or associated with the oral cavity directly. Slide about the teeth. So we're going to talk about 4 main types of teeth: incisors, canines, premolars, and molars. These are the adult teeth. We all start with baby teeth that come in within the first couple years of life. And then we start to lose them starting around 6 or 7 years old. And so in the parentheses here, it's showing when those adult teeth come in. And that's going to range from about 7 years to 13 years for most teeth. And the wisdom teeth, the back molars, can come in even later. As far as the types of teeth, they have different shapes. The incisors are flat and they have a ridge. The canines have come to a point. The premolars are relatively small and mostly flat on the surface. And the molars are large and flat on the surface. They allow you to do different types of chewing or mechanical digestion to your food. So the incisors, being flat-edged, allow you to kind of cut material off. You can take a bite with your incisors, and that's going to slice it. Canines coming to a point, they're for puncturing or piercing some kind of food, and you can shred it with the canines. Both the premolars and molars, being mostly flat on the top, are good for grinding and crushing food. So you move food around in your mouth. When it's, when you've torn a piece off, move it to the back, chew it with your molars and premolars, and that's where the grinding is going to happen. All right, the salivary glands are also accessory structures in the oral cavity, and the main thing that the salivary glands are doing is they're producing and secreting saliva. Saliva functions to do the following. It helps to cleanse the mouth out after you eat, and in general helps to protect you. The mouth is an entry place for potentially bad things, pathogens, and other, particulate structures. It helps to moisten and dissolve food, so that's the bolus formation. Moistening food helps it to pass through, especially the upper digestive tract. Think of really sharp, pointy, dry food. If that wasn't moistened, how painful that might be or abrasive that might be moving through your digestive tract. So that's the bolus formation I talked about before. Salivary glands have a couple of enzymes that allow you to break down starches and lipids. And there are a number of proteins that are mostly protective as well. There are 3 pairs of salivary glands, left-right pairs, and these are called the parotid, submandibular, and sublingual. The parotid gland is kind of off to itself. This lies anterior to both ears, and it has a duct. Salivary glands are, of course, exocrine glands, so they contain ducts. And the ducts carry the secretion saliva from the gland to an opening in the oral cavity. For the parotid gland, the duct runs along the vestibule, the space between the lip and the teeth, on the upper teeth, and it secretes saliva into that space. The submandibular and sublingual lie in the floor of the oral cavity. Submandibular along the jawline, sublingual under the tongue. And these have ducts that empty into the space below the tongue. This slide is showing parotid gland here. That's the largest. And if you feel around in front of your ear, you can sort of feel that, and you might even be pushing some saliva out if you press on it. Here's the duct running in the vestibule. So that saliva from the parotid gland is going to empty into this space. Here is the submandibular and sublingual gland. Submandibular gland has one duct emptying into an opening at the very front of the tongue. It's called the lingual frenulum. That's here. The sublingual gland has many ducts opening into a number of orifices running along the lateral surface of the base of the tongue. As far as the composition of saliva, it's mostly water, but it does have a number of things that are also dissolved as solutes within it. So a lot of electrolytes, shown here, sodium, potassium chloride, phosphate, bicarbonate. Couple of enzymes, and this is going to start the process of chemical digestion. Salivary amylase and lingual lipase. Salivary amylase is going to be active, in your mouth, and that can start digestion there. Lingual lipase, even though it's present in saliva, it doesn't become active until it hits the acidity of the stomach. So it's secreted in the saliva, but is not yet active. These are the proteins that I mentioned that are dissolved in saliva. So one is mucin, and that's going to dissolve and make mucus. So that's part of what's secreted in saliva. It's not very thick mucus in saliva, but there is some of it. And all of these, lysozyme, defensins, and immunoglobulin A, are proteins that are protective. They are, lysozyme, for example, is an enzyme that can break down bacterial walls, and that's going to destroy them. Defensins have a similar defensive role in protecting against microorganisms. And IgA is an antibody that's going to bind to certain types of pathogens entering into the mouth. So saliva has both a digestive role and a protective role, and also kind of a role in mechanical digestion by dissolving food during the mastication. All right, I'm going to end this video here, and we'll pick up with the pharynx and the esophagus in the next video.